The ribs or costals are categorized into true and false groups. As I said, we've got 12 ribs on either side, yes, 12 on the right and 12 on the left. How many ribs articulate directly with the sternum? Let's count. 1, 2, 3, 4, 5, 6, 7. So remember that just the first 7 costal cartilages articulate directly with the sternum. And because of that, in this category, the first 7 ribs are considered as true ribs, and the remaining ribs are considered as the false ribs. In another and more acceptable category, the ribs are divided into 2 typical and atypical groups: typical ribs and atypical ribs. Which ribs are typical ribs? R3 to R9 are typical ribs, and the remaining ribs are atypical ribs. So remember that R1, R2, R10, 11 and R12 are atypical ribs. Typical ribs share common anatomical features, whereas the atypical ribs have different anatomical features than the typical ribs. Here you can see a typical rib. Let's study the anatomical features of the typical ribs. A typical rib contains a posterior end and an anterior end, which, as you see, its anterior end articulates with the costal cartilage. On the posterior end, we've got the costal head. Here's the costal head, costal neck, and the costal tubercle. That part of the rib located between the costal head and costal tubercle is the costal neck. The costal tubercle, look at here, the costal tubercle contains 2 parts: an articular part and a non-articular part. And as you see, the costal head has 2 articular surfaces separated by a crest. Yeah. So remember that the costal head articulates with 2 vertebrae. Each typical rib posteriorly articulates with the corresponding vertebrae and a vertebrae above. What's the corresponding vertebrae? For example, here we've got the 5th rib, or R5. Corresponding vertebrae for R5 is T5. For example, corresponding vertebrae for R7 is T7. Corresponding vertebrae for R4 is T4. Okay, and remember, the head of each typical rib articulates with the corresponding vertebrae and vertebrae above. So here the R5 posteriorly articulates with the T5 and T4. Here is the posterior end, and here is the anterior end of the rib, and this part between 2 ends is considered as the body. Here is the body of the rib, and as you see, the body has 2 surfaces and 2 borders. Its surfaces are external and internal surfaces. Here is the external surface and here is the internal surface, and its borders are superior and inferior. On the lower part of the internal surface, we've got a groove called costal groove. Here's the costal groove containing the intercostal vessels. Here you can see intercostal vessels and nerve, and as you see, the highest structure is the intercostal vein, and the lowest structure is the intercostal nerve. And as you see, the intercostal artery lies between the vein and nerve. Okay, as I said, the head of a typical rib articulates with two vertebrae, with the corresponding vertebrae and a vertebra above. This joint, another view for this joint between the costal head and the vertebral body. This joint between the costal head and vertebral body is called costovertebral joint. Costovertebral joint. What about the costal tubercle? As you see, the costal tubercle, its articular part, the articular part of the costal tubercle articulates with the tip of the transverse process. Each vertebra has two transverse processes, and this process articulates with the costal tubercle like this. This joint between the costal tubercle and transverse process is called costotransverse joint. Here is the costovertebral joint, and here is the costotransverse joint. Here you can see some ligaments, some supporting ligaments, and here we've got the lateral costotransverse ligament, which supports the costotransverse joint. And remember that the costovertebral joint is supported by the radiate ligament. Here is the radiate ligament, and here is the lateral costotransverse ligament. Remember that the lateral costotransverse ligament attaches to the non-articular part of the costal tubercle to support the costotransverse joint. And here in this space between the costal neck and transverse process, we've got another ligament named the costotransverse ligament. Okay, so remember that here we've got costotransverse ligament between the costal neck and transverse process, and also we've got lateral costotransverse ligament, which is attached to the non-articular part of the costal tubercle. Let's see the atypical ribs. Which ribs are atypical ribs? R1, R2, R10, R11, and R12. Here's the R1, or the first rib. The first rib is the smallest rib. Why is the R1, or the first rib, is atypical rib? Because as you see, its head, unlike the typical ribs, has just a single articular surface. The head of the typical ribs has two articular surfaces separated by a crest, whereas here the first rib has just one or a single articular surface to articulate with T1. In addition, unlike the typical ribs, it has the superior and inferior surfaces. As I said, a typical rib contains external and internal surfaces, yeah? Whereas the first rib has the superior and inferior surfaces. So it has internal and external borders, not surfaces. Another reason is this tubercle. The first rib, in addition to the costal tubercle, has another tubercle called scalene tubercle. Here is the scalene tubercle located on the superior surface of the first rib, and this tubercle gives attachment to the anterior scalene muscle. On either side of the neck, we've got three scalene muscles: anterior, middle, and posterior scalene. And the anterior scalene muscle attaches to this tubercle, to the scalene tubercle, and because of that, this tubercle is called scalene tubercle. And here, as you see, in front of the anterior scalene or in front of the scalene tubercle, we've got a groove for subclavian vein. Here is the subclavian vein in front of the anterior scalene, and behind the anterior scalene or behind the scalene tubercle, we've got a groove for subclavian artery. Here is the subclavian artery, and here is the subclavian vein. The second rib, or R2, is a typical rib because it has no distinct costal groove. Its costal groove is not more visible, and because of that, R2 is considered as an atypical rib. What about the three lower or lowest ribs? R10, R11, and R12, as you see, articulate just with one vertebra. Yeah, as I said, the head of each typical rib articulates with two vertebrae, yeah, with the corresponding vertebra and a vertebra above. Whereas here, for example, R12 or R11 articulates with just one vertebra, and as you see, R12 articulates just with T12. R11 articulates just with T11, and R10 articulates just with T10. Here is the R12. As you see, its head has a single surface to articulate with T12, and also this rib R12 has no costal tubercle. It has no costal neck. It has no costal groove. Okay? Thanks for your attention.